An East Ridge woman battling cancer is on the verge of losing her health benefits because she makes too much money.
She's been living on a fixed income for more than 10 years, and she says she's afraid she won't be able to afford her cancer treatments if she loses those benefits. She contacted Local 3's Xavier Harris for help. He joins us now in the studio with this 3 on Your Side report. Xavier.
Greg, David, Brenda Higley is so close to the finish line of beating cancer. She says what's stopping her is not anything health related, but it's her health insurance, Medicaid. Now, she says she's been trying to get answers as to why her benefits are going away, and she feels like her cries have been falling on deaf ears.
I don't want to die from something that I could be cured from.
That cure could be 6 treatments away. Brenda Higley says since last year, she has received 6 of 12 radiation treatments, and her CT scans are showing that her cancer is going away.
And at the end of the 12th one, if my scans are still clear, there's a 99% chance my cancer won't come back.
She says up until November of last year, she was very optimistic of beating cancer. She says each year she's required to recertify for her TennCare benefits, so she did.
I filled out and sent in the 32 pages of questionnaire, and then I get a denial letter. And I called them, and I said, why am I being denied? She said, well, you're over the limit of what you're allowed to make.
Higley says for 13 years, she's received Social Security income, which is a little less than $2,000 a month, and it's the only income that she has.
I'm not allowed to spend my Social Security check on just anything that I want to. You know, the rent, utilities, car insurance. No, it all has to come out of that check.
TennCare denied her application because of a cost of living adjustment. Higley says she filed an appeal 3 times, and each time her claim was denied. Desperate for help, she says she reached out to Medicaid, the governor, his chief of staff, and even state leaders for months. We reached out to those same people, questioning why her benefits were cut off. And during our interview,
Hello.
She got a call from a TennCare representative.
The governor's office had reached out to her. I said, really? She said, well, I'm going to see what I can do to help you.
TennCare responded to us for comment, saying that Higley was denied because her income exceeded the limit of $1,275. They are now taking another look at her appeal, and they say her coverage will still be in effect until a decision is made. Higley says while she's grateful for this opportunity, she wants to make others aware of what's going on with Medicaid and their health benefits.
Yes, it scares me, and it also makes me angry, because I don't feel like anybody has the right to decide whether I'm going to live or die based on medication that they don't want to pay for.
Now, after speaking with state senators, I learned that thousands of Tennesseans have stopped receiving TennCare benefits. Senator Heidi Campbell, who serves District 20 in Davidson County, tells me it's all because of the new cost of living adjustment.
Well, you know, I mean, we really need to force TennCare to reconsider their decision to kick people off based on a COLA adjustment. So there was a cost of living adjustment done for Social Security. And because they did that cost of living adjustment, people who had been eligible for TennCare all of a sudden weren't eligible for TennCare because they'd made just a little bit more on their Social Security. And they were kicked off without knowing that they'd been kicked off. And, you know, what we really need is a COLA adjustment for TennCare as well.
Xavier, will that cost of living adjustment impact other people? And if it does, what can they do?
Well, Greg, certainly it will. Like we said before, Senator Campbell says thousands of Tennesseans have already been kicked off and they don't even know it yet. She says the best thing that they can do is reach out to their legislature and demand that they make changes. And she says that's something that they're actually pushing for, but obviously they have to wait until the next session.
Certainly check on those insurance benefits too. Xavier, thank you.